Nutrition is a critical part of health and development. Now the double burden on malnutrition, rising anemia, obesity, high incidence of vector-borne and neglected tropical diseases have bearing on India's demographic dividend, growth, productivity and GDP. Poor health and nutrition outcomes are deeply unfair. Women and children, people from most vulnerable communities like the tribals, are hardest hit. Recent pandemic and climate change effects have compounded the problem and has a bearing on achieving the UN Sustainable Development Goal targets as well. Today we have with us eminent experts and champions from food, nutrition, health and climate change sectors to understand what is really happening in the public health and nutrition sector and what is the way forward to achieving the mission of a nourished and healthy India that is inclusive, accountable and climate smart. So let me introduce our panel. We have with us Dr. Akshay Dhariwal, former Director NCDC and former Commissioner MCH, Dr. Bhupendra Tripathi, Deputy Director Infectious Diseases Vaccine Delivery, Bill and Melinda Gates Foundation, Dr. Sandeep Nair, Principal Director and Head Pulmonology BLK Max, Dr. Vivek Singh, OIC Health UNICEF India, and Dr. Anurag Agrawal, Bioscience and Health Research Trivedi in School of Biosciences, Ashoka University. Thank you all so much for joining us today. Dr. Dhariwal, I would like to begin with you here. You've had an expertise in public health for over 4 decades. Basic question, what really is the status of nutrition in our country and why is nutrition the most important component of health?
Thank you. First of all, I would like to make a statement that public health is very important. India needs public health and public health is needed for India. The core of the public health specialty is epidemiology. And when we talk of epidemiology, the distribution of and determinants of the disease occurrence. In that respect, nutrition is the most important determinant.
Yes.
If nutrition is good, that many of the things may it be communicable disease or non-communicable disease, the lifestyle diseases are taken care of.
Okay.
Now your question that what is the status of nutrition in India, no doubt as has been made in the opening remarks by somebody that it's still a problem.
Yes.
And when we talk of the problem is in form of the accessibility of the food, the equity issues are there, the availability issues are there, and on the top of everything, the factors which are responsible for causing the nutritional problems are continuing. But having said so, I would say that over the period of time, we have progressed a lot. I recall that the severe PEM used to be a problem about 3 decades ago, but now we don't see those type of things. Lot of epidemiological inputs and the strategic changes have been made in the program that has made dent, and that is where this particular thing that generalizing the intervention everywhere doesn't solve the problem. The localization of the problem is very important. So I would put in that perspective that the practice of public health and in particular epidemiology in the field of nutrition where the research becomes important. Like just citing an example of anemia prevention, we had a big program started with, I would say, fun and fair, that deworming is going to solve the problem of anemia. But probably that decision we were discussing within our group, that that decision that to generalize it has not worked. That is what has been observed. And that is where this evidence-based policy changes are making now the nutritional status better in the country.
Definitely, and work is happening on the ground. Government is doing the bit. We say how collaborations are, the private sector, the NGOs are working, and that's what we're going to be discussing. But just before we move ahead to talk about nutrition, I think One Health is a concept, Dr. Agrawal, I would like to ask you about. Post the pandemic, we know the concept how health of humans and animals and the environment are linked, right? We talk about it. We all say One Health. We've been using this term a lot. How can we put it into practice? How do we integrate it? I think to begin, we start with that.
I think the magic word was spoken a minute ago, collaboration. But beyond collaboration, there are structural problems in how we do this. So we all know that One Health is spread across multiple dimensions: animals, forests, environment, agriculture, humans. But if you were to look at it organizationally, how we organize this thing, everything is a different ministry or a different department. In fact, if there was an outbreak in a forest and a forest wildlife specialist wanted to investigate the outbreak, they wouldn't have any access to any biosafety labs, which are all under different departments. What India is doing, and which is very creditable, is now using the Prime Minister's office, all departments are coming together in Nagpur to create the National Institute of One Health. In the beginning, imagination was thought to be a branch of ICMR. Today, ICMR is only one of the stakeholders supposed to run the place, but 13 different departments and 5 different ministries are coming together to do it. In fact, in a future, you will see that every time there is a problem, there will not be a person from one department, one institution, one ministry that will go to look at the problem. A crack response team, everybody might go. Those who are not needed would come back. And of course, beyond the structural organization, it requires a change in thinking. In fact, sometimes I joke, the biggest problem in One Health is that in thinking of health, we don't think of it in one common way, but that I'm sure will happen.
So, everybody must be wondering why I said, asked about One Health and how is it connected? Well, that's where I'm coming to Dr. Singh. Climate change has a long-term threat to food security and nutrition. So obviously climate and environment. So that link, that's why we went on how do we put it across. According to some reports, Dr. Singh, by 2050, the risk of hunger and malnutrition could rise. Now, how do we create an environment, a healthy environment for healthy children? I'm asking children because they have the longest lifespan.
I think that's a very pertinent question, and the first point I would like to mention is, like we were just discussing yesterday, there was a time when we used to enjoy winter for 4 months, right? So now we are seeing that proximally. In the light of the statistics that you've mentioned of what climate change can do to food security and malnutrition, I would like to point out that when the UN Secretary General wrote his annual report in 2020, in the report it was said climate change is the biggest threat to the legally ratified document, Convention of the Rights of the Child, whereby countries like India and all signatories have ensured that children will have certain rights in that convention. In that report it was said climate change is the single issue with which implementation of CRC is at stake. So not just nutrition, but the whole issue of survival and development. Now, why bringing children here is important? Climate change, we know, is disproportionately, 90% of the burden, morbidity, is among children and women because of the special situation we know. And especially when it comes to climate and environment, children by their body mass, they consume, they inhale more than the adults. We all know that they are in the developing phase. Yes. So a child born today, by the time she or he turns 71, would have seen at the current race 4 degrees rise in temperature, which would mean that we are saying if rise in temperature is beyond 1.5 degrees, all the COP28 declarations and everything that's happening, what catastrophe it can bring. So imagine we are giving our future generations a life where they would see 4 degrees rise. So we know food insecurity will happen. But I think we also have now solutions. People are waking up to this occasion.
How do we improve things?
So 2 things. For the first time at COP28, there was discussion on health. There was a health day at COP28. And it was said that we would bring in children at the center of the discourse, and in another 2 years, the COP28 should have children in all policies for doing three things. First, they should have voices in the adaptation measures. They should have voices in mitigation. And they should also have voices in actions which lie mostly outside of the health sector. So fossil fuel usage reduction for the temperature lowering. So these are actions which are outside of the health sector, but health sector can help raise those voices. For example, if India says we will make good of the demographic dividend, we know that high lead levels can lead to irreparable damage to our IQ, the learning ability in kids. So we have to make sure that we bring children at the discourse of
So that's where
climate and
healthier environment definitely affects nutrition. We may not be realizing it now, but yes, from soil, like you said, food insecurity. Now we do know nutrition is a problem, malnutrition, we see MAM, SAM, we've heard of all that, anemia, micronutrient deficiency. But Dr. Nair, I would like to ask you here about obesity. Malnutrition, yes, we are struggling for years, for decades in fact. This double burden, and how is this connected? We also see, because of malnutrition, obesity, this whole connection, the NCD is increasing, the non-communicable diseases.
Yeah. So two things when we talk about the nutrition. One, on the one side, we have undernutrition, and the other side is overnutrition. And unfortunately, many of our fellow colleagues, or even the children, childhood obesity, you see there's a rise in obesity, and almost 3 to 4% of the children are obese as per the data. And even then among adults, the obesity is quite common. And not only obesity per se, obesity as such is problematic by itself. It can also lead to many diseases per se. For example, if I'm a pulmonologist, I'm seeing a rise of asthma among the obesity, and there's a known comorbid, and in fact is the commonest comorbid in asthma to have an obesity with there. So when you say that my plate is full, or my tummy is full, or my belly is full, that doesn't mean you have taken a good food. It means that you may not have taken the nutritious food. So even a mother has been to be taught that if your child's stomach is full, I hope that the child has taken the nutritious food. Well, that's very important. That's how this fortification of the rice, the vitamin A supplementation, and everything is very important. Now, this obesity is really troubling us, and about 20-22% people are becoming obese, and especially it is seen more in the urban place as compared to the rural. In rural, we see more of undernourished, and the urban, we see more of the obese people. And this is a place where we have to really take care of it, and we have to teach it accordingly. Many of them of us have become lethargy. We hardly go out because of this, whatever gadgets we have we hardly play outside, we hardly exercise.
Our lifestyle.
Our lifestyle has become really bad. So this obesity is the biggest epidemic, and it's one of the commonest non-communicable disease. And if we go in this rate, we are going to have a tough time.
Yeah, so at one side, we say so many of the kids are malnourished, Indians, and then obesity we are struggling with. When we say public health and nutrition, Dr. Tripathi, I would like to ask you here about the NTDs, sorry. We see filaria, we see Kala Azar, and the Prime Minister has spoken that eradication is a must for this. Can you tell us the impact of these diseases on nutrition?
So first of all, I want to thank you for raising neglected tropical diseases as part of the panel discussion. Because the word neglected is actually neglected from every forum, whether it is health, whether it is policy, whether it is panel discussion. So I'm glad to hear that this term is being brought in. So for those who have not heard this term in the past, neglected tropical diseases is group of diseases or disease conditions which WHO has classified, and there are 21 disease or disease conditions which are part of NTDs. Now, as the term tropical is there, so it's very clear that those countries which are in the tropics, they are the countries mostly affected by these diseases. So countries which are actually on the upper and lower than tropics, they are not that much affected. And the neglection is not only for neglect because of money. There is neglect in the new diagnostics, there is neglect in new drugs availability, and neglect in the funding from the countries themselves. Now, having said that, there are some diseases which are meant for eradication. There are some diseases meant for elimination. Third, elimination as a public health problem. And fourth, control. We cannot eliminate. So as part of that, there is like a disease known as guinea worm and yaws, which we have eradicated from India at least. Guinea worm is still in Africa. For diseases like leprosy, we did eliminate in the past. We got the certificate, but it was at a national level. And all the experts sitting here, you all know that the leprosy in the younger age group, India is contributing the most, which is a sad part. Now the third condition of elimination as a public health problem, we have lymphatic filariasis, we have Kala Azar, we have salt transmitted helminths and many more diseases. Even trachoma and rabies are in that group. How much do we actually focus on them? And I would like to let everybody know that Dr. Dhariwal is sitting here. He was the pioneer in bringing a new therapy for eliminating lymphatic filariasis. In the earlier days, we only had two drugs, albendazole and DEC, which was given as part of National Mass Drug Administration campaign. And then ICMR did a very nice study in India. It was a global study actually. India was one of the multiple sites where ivermectin was added. At that time, ivermectin was a big name. Oh, why we cannot use ivermectin? Yeah, but in COVID, you must have everybody must have consumed the ivermectin. Yeah. It's basically a drug which is meant for parasites. So what happened with the triple drug therapy? If everybody in that geography consumes once a year, 95% microfilaria is killed, and 2 years we can actually eliminate. And that is the reason why National Center for Vector-Borne Disease Control has taken up in a very big way. We have 20 states where this disease is there. There are 339 districts which are endemic for this disease. As of now, twice a year campaign is being run in those districts. Kala Azar is second disease, which is also a neglected tropical disease, limited to 4 states in the country, 54 districts. And I'm very happy to see that this may be the first year where all the blocks in the endemic areas will be below the threshold target. And this will be announced, I cannot say before that. Yeah. So on connection with the malnutrition. Yeah. So there is a disease known as soil transmitted helminth. Basically, you must have heard of roundworms in the body. Now roundworms, they live in the intestine and mostly kids have these things. We focus so much on adding food. And many a times in those populations, the hand washing behavior is not that good. Yeah. So kids who are given lot of food to eat, but if they are having roundworm in their intestine, who is eating the food? Yeah. Those worms are eating the food. So essentially, we need to connect these dots. And there are other diseases also which are linked with these things. Like, we have flatworms. Which go basically,
so deworming is key.
Deworming is very important, and as part of the triple drug therapy for lymphatic filariasis, we are giving albendazole and ivermectin. This not only kills the filarial microfilaria, but they also kill these roundworms.
Yeah. So drug administration is critical.
Exactly, and they also have additional benefits like they kill hookworm, which causes anemia in people who have it, especially women. And then it also kills the mites, which we have on the body, scabies, and those, lices which we have in the hair. So if this is known to people, they can actually get multiple benefits. But the problem is drugs are being given by the government free of cost at home and people do not consume because they feel I am apparently healthy, why should I consume? Now we need lot of IEC, social mobilization to make people understand this is not only going to help for one disease, but for multiple diseases.
And how it impacts the overall health of everybody.
Absolutely.
Yeah.
So if...
Yeah, absolutely. I think what you put that, Dr. Dhariwal, I wanted to come to you, sure. to ask you about this because, you had spoken about this as well. You've also worked in this line. Government has so many schemes. We have Ayushman Bharat, Poshan Ma, Anemia Mukt Bharat, the Pradhan Mantri Garib Kalyan Yojana. So many schemes are there. How do we make it a people's movement? I think how can communities be a part of it? Dr. Tripathi did say, awareness is key. But we have the schemes. How do we make it bigger?
See, this is the most important component in the public health practice. That making program is one side of the story, but taking those program strategy to the last person is the most important. And in that respect, there are different ways in which it is being done. And the most important one means in the health sector, which we have seen, two important institutions which are there, the Village Health Sanitation Committee and the Mahila Arogya Mandal, are the established one. At the same time, at the most peripheral level, self-help group, the community teams, taking the messages to that level is one aspect which is very important, which is being done under the different programs. And when it comes down to, again coming back to that discussion, that it's not important that we generalize it. Again, epidemiological input, and I would like to cite example, two examples. Number one is from the TB side, which is the top priority, the National Tuberculosis Elimination Program, in which over the period of time we were discussing, Dr. Nair and myself come from that background where we have seen a lot of cases of tuberculosis with that problem of malnutrition, predisposing factor, and then presenting. So now the evidence generated and has been now translated in action in form of what we call as the Niche Poshak Yojana, in which for the food component 500 rupees are being given to each registered case that take care of agreed, means this may sound in the larger context a small amount, but for those it matters. 500 bucks is also important.
Absolutely, yeah.
Second example I would like to give is of acute encephalitis syndrome. We, 1 decade ago, Gorakhpur, Muzaffarpur,
yes,
or for that matter, northeastern states used to be in news.
Yes.
Now, for last 4 or 5 years, I'm seeing that we don't hear the name of acute encephalitis syndrome. Lot of mortality is taking place. There also this the nutrition component and making these things available in the community, like in Muzaffarpur. I recall that persons were dying, the children were dying because of the hypoglycemia in the mid of the night. Because coming from poor background, no availability of food, and then the mother was not able to provide meals in the night. So this study then what we saw, the food availability, and particularly I would like to bring in here the millets for the discussion. When we are talking of nutrition, millet is important.
In fact, I have another question for that, how we are going back to roots. I'm going to come back to
so
millets.
I'm just helping you in that respect.
Definitely have that question, because that's important. We are talking about going back to our roots, and even Dr. Nair, we've all spoken about how important a healthy and a nutritious diet is. Dr. Agrawal, we know that how important nutrition is for every disease. You know, Dr. Dhariwal spoke about it, Dr. Tripathi has said. Now, anemia or any deficiency, whether it's micronutrient, has a intergenerational impact, right? How do we ensure that our adolescents or our girls, you know, which ultimately grow as mothers or women, that they don't get consumed in this intergenerational cycle of malnutrition? Talking about the life cycle approach.
You know, in many studies where you look at health indicators of populations, one of the best predictors is the education level of the grandmother. Not the mother, the grandmother. Of course, education of a woman is anyway indicative to some degree of the level of affluence, etc. But it has to start at the grandmother level, because then your mother was born with the right genes through a pregnancy with adequate nutrition, and that sets the stage for the child to be born with the right set. Now, it's clearly not sequence, right? I mean, your sequence does not change. What happens is your genome gets modified by a variety of things so that it expresses itself differently based on the nutrition you faced. And not just you faced, your grandparents, particularly the grandmother, because she contributes a dominant part of your cell that you were born with. Now, this is sometimes referred to in India as hidden hunger. There is no obvious caloric hunger. But when you start looking at micronutrients, and you can talk of anything, vitamin A, D, B12, iron, iodine, zinc, it doesn't really matter. Some of them are a little bit more important in terms of how you modify the genome, but by and large, together, they affect the processes by which lack of health can be continued across generations. And if you look at it very seriously after generations of eradication of any kind of hunger in the most affluent, you realize many of the global differences disappear. We might think that Indian babies will be smaller, Indians are shorter, Japanese are shorter than Scandinavians. Take the most privileged class after 2 to 3 generations of complete lack of any deprivation. All indices start coming similar again. In fact, in the US, they found the median differences between the Japanese and Scandinavians who had been living in the country for over 2 generations. There was no difference. So much of what we think is genetics is not. It is chronic deprivation, either by practices that are independent of affluence or simply because of lack of money for the nutrition.
I think that's really well explained, and what you said about the grandmother, and that's because you always hear the mother or the mother's education, so I think that's something we've all learned. Dr. Nair, Dr. Agarwal did touch about hidden hunger. So we do know micronutrient deficiency is all pervasive. How can we address this problem? We know about the food fortification program, supplementation, diet diversity. Tell us about that.
Yeah, see, if you remember the fortification of the rice, how it took place, it was a very nicely took place. They took the rice flour, mixed the nutrition, and then again reformed into rice, because you are fond of rice eating only. So what they did, the rice flour, mixed the micronutrient, and then again transformed into rice and gave it to the public. Because many of us are rice eaters. They want to have that particular place, but unfortunately most of the rice was not fortified, didn't have all the micronutrient, nor didn't have all the macronutrient. So after fortification of the rice, they become equally good. So that is a good program to be taken off, and many other programs. Giving a vitamin A prophylaxis to the young children has really led to ruling out night blindness in many of the patients. Then iodized salt has ruled out goiter in all of us. So definitely these are taking place, and it has come in a big way, and now you see many of the malnutrition going down to some extent, but still there is still to reach to more in the rural area, because many of the children or the even the mothers, they don't have access to that particular quality of the food what they can. And unfortunately, even in the urban area, we are probably not taking that quality of food, and we're going for more of, you can say, starvation because of eating a wrong food.
Yeah, so eating right, and what you said earlier also, lifestyle is very, very critical.
Very important for
exercising. I think we are going to be also talking about that aspect
absolutely,
as well.
Absolutely.
Dr. Singh, we are talking about public health and nutrition. Now, when we talk about universal health coverage, which is UHC, primary healthcare plays a very important role. What is UNICEF's view on this? Because you all have been working on ground on this. Because it really starts when you're young. But like Dr. Agarwal said, it starts actually before, like grandmother times. It really starts early, but at least when you're in your lifetime, if you start working young on children.
I'd like to connect some of the dots from 2 or 3 interventions. See, primary healthcare for universal health coverage in the context of what we are talking today, public health and nutrition. Let's take the case of NCDs, and I would like to go back to the point that genes also get affected by environment. So the primary healthcare we are talking of says that we should have healthcare services as close to the communities as possible, empowering them with the tools and the knowledge to take care of their own health, upholding the human right, health as a human right, promoting social protection so that people don't get impoverished, and then only you can achieve universal health coverage, which has 3 dimensions: reaching everybody, poor or rich, urban or rural, with the same quality kind of services, and such that they don't get impoverished if they have to seek health care. Now, coming to NCDs, for example, and nutrition, see, we feel that government yesterday announced a very ambitious program of treating 75 million people with hypertension and diabetes. Yeah. But imagine, by the time NCDs manifest, we have spent 40, 50 years of these dysfunctional lifestyle and nutrition, which has led to this manifestation. So all the risk factors start getting established or enhanced from preconception. When a mother is conceiving, epigenetics has its role. Then through the pregnancy, what mother eats, the nutrition of the mother and how she is mentally to deliver a baby who's healthy or not. First 3 years, the sensory system is developing. So what the child eats, my child knows that good drink is coconut water. Vis-a-vis another child in house knows only, I want Coke. Next 3 years, the child will observe what is the right thing to do.
Yeah.
So unless we do this life course approach,
Yes.
thinking of primary health care where we have multi-sectoral actions because there are so many determinants.
Absolutely.
And finally, the point which is very relevant in the context of the pandemic we saw once in a century, when we speak of population resilience, NCDs had a major role. We were dealing with a communicable disease, but healthy populations were more resilient. So when we are to talk about system resilience, we also need to talk about healthy eating and healthy population.
So when we talk about, thank you, when we talk about public health and nutrition, it's really vast because everything is some way connected, whether it's your diet, whether it was, the neglected tropical diseases. So another thing is, I think, vaccination. We need to talk about that. I know we are running short on time, but when we, Indradhanush, Mission Indradhanush is the largest immunization program. And Dr. Tripathi, while we know, routine immunization is important, can you tell us, our viewers, how important or what happens if you don't take routine immunization? How does it impact nutrition? Because I was trying to find a connect on that.
So, very good point you have raised. So, Mission Indradhanush essentially was a program to find the children who have missed out or dropped out. So, it's part of the routine immunization. So, as of all of you know, routine immunization has multiple vaccines. I just want to pick up 2 vaccines for discussion. One is a rotavirus vaccine and second is measles vaccine. So children who have received rotavirus vaccine on time, the incidence of rotavirus diarrhea comes down. So any diarrhea which happens to a infant essentially ensures that the child goes into malnutrition.
Yeah.
Because diarrhea in itself is a big factor for malnutrition.
Yes.
Similarly, if a measles case happens to a person, a child who has not taken measles vaccine, what happens? Measles happens. Measles apparently goes away like in 7 days, 10 days times. The fever will get down, the rashes will go away. But they don't understand the immunity has actually got impacted. And children who have measles, they are highly prone for pneumonia, for diarrhea. And their antibody level to fight other infections also goes down. Even vitamin A level has been found to be really low in post-measles cases. Even, they have brain infections as well. So these immunization, items have to be raised in the community, in the public health discourse, that every family should understand that vaccination is not about, 6 and 10 and 14 weeks vaccination. It essentially is a lifelong vaccination, like 9 months, 1.5 year, 5 year, 10 year, 16 year, and then pregnant mothers will have their own. So there is a very clear-cut connection between vaccination and the outcomes in terms of malnutrition.
Malnutrition. Thank you for explaining that. So before we wrap, a quick closing remark. I think for you, I have a specific question is going back to our roots, Dr. Dhariwal. Use of millets, we've been talking about it. A lot of, we at our homes, we've started using it. A crop which we had forgotten.
Thank you. This is the most important, I would say, close to my heart, the traditional values, the traditional systems, which are based on our own experiences. And some of the things I feel that we are rediscovering. It was already there, but because of certain regions, we forgot it. And now we have realized that these are the things which are probably better. And in colloquial language, we commonly say that for health, what is most important is your ahar and your vyavahar.
Yeah.
And here we are talking of ahar means, nutrition means ahar. And what we take, what time we take, what items do we take, again in terms of the time period also means this was part of our traditional wisdom,
yes,
which somehow probably we forgot. But I'm happy to see that because of the social media, now we have started talking of it.
Yes.
And a lot of messages
so I think
get viral.
A takeaway here is what you said, ahar and vyahar. So quickly before we have a minute, Dr. Agarwal, your closing remarks, you could give a solution, you could give what we really need to, for public health and nutrition. A line on that from each one of you, please.
Sometimes we think information is the issue. Usually by now, given all the media connect, information is actually a commodity.
Okay.
It is motivation that is the issue. So I think we have to switch our targets from simply informing people to strategies that motivate people. These could be digital. These days people are talking about digital vaccination that got nothing to do with the vaccine.
Yeah,
They're
true.
entirely behavior modification.
So
I
motivation.
think that's the future.
Thank you for that. Dr. Singh, a line from you, please.
You know, I would say we all have a part to play, whole of society approach. And I would pick on this millets mission. So even climate resilient.
Yeah.
We have so many good programs. The Prime Minister urged the country on this weekend for youths to come up with innovative solutions for health and nutrition. There is this Life India campaign.
Yes.
Lifestyle for environment. Yes. There are so many campaigns for all of us to anchor, and I would say 4 stakeholder groups have roles to play, A, B, C, D. A is the administration, the governments to take things to scale.
Sure.
Businesses, if you want to see from a utilitarian perspective, healthy population, good for businesses, invest in health and nutrition solutions. C is the civil society.
Okay.
Putting people at the center, raising accountability of the stakeholders that are serving the population. Just last week, I met a type 1 diabetes group, children who went to the National Commission for Protection of Child Rights and made the commissioner write to the schools that these children have special needs. When they come for exams, they need to take insulin twice a day and something should be done about it. So civil society has a role, and D, development partners like the foundations and the UN can bring in global best practices.
So I think critical, the ABCD. Dr. Nair.
Yeah, so I think from my side, I can only say that have a good nutritious food. Our children are not fond of eating bread, so we have got a multi-grain bread to fulfill the grains also. At the same time, go for some exercise. It's a stressed life. We don't have open spaces. We don't have time, but we must thank our Prime Minister who is supporting yoga. So you can do a little bit of yoga at home.
So be mindful of what you eat.
Because your lifestyle
and again,
is very important.
Physical exercise as well, which takes care of mental well-being as well. And lastly, Dr. Tripathi.
So I would say the most important thing is, looking into equity.
Equity.
Like this
Health
is
for
not
all.
exactly, it's not like everybody will have the same problem. There will be pockets which will have more problem as compared to others. So the use of data is very important. In nowadays, when we have digital landscape for everything, use of data, timely, correct, reliable data, and actions are taken on that data will be the real thing to, stop this gap. And obviously, when we know the problem, we have the solutions most of the time. And if we can apply the solutions,
we'll ensure
there is no
that health
reason
is accessible to each and everyone.
Yeah.
Thank you all so much. It's been a pleasure to have you with us. Thank you so much. So despite high public investment, India still has numerous health and nutrition related issues and challenges which need attention. Things have to happen at the grassroots. There has to be a Jan Andolan. As individuals, we need to be mindful of what we eat, look at the holistic well-being. Also, the robust governance will be important to ensure that partnerships benefit communities and people.